Welcome to Making Communities, Public Science in the Time of COVID-19. My name is Nicoletta Pireddu. I'm the inaugural director of the Georgetown Humanities Initiative. This initiative, under the auspices of Georgetown College, aims to foster dialogues and collaborations across departments inspired by the integrative and inclusive educational mission of our university. We see these synergies at work in today's event, which brings together different academic units and disciplines to reflect upon the value of public science and public-facing humanities, and the role of communities in devising solutions to complex problems like the ones we're confronting with the current pandemic. We owe the idea of this event to Dean Bernard Cook, so on behalf of all of us in the panel, I wish to express my gratitude to him. And a special thanks to the Georgetown Medical Humanities Initiative and to the Maker Hub at Lauinger Library for their co-sponsorship. We will explore the worlds of open science and maker culture in a conversation between Margaret Talbot and Don Undine. Margaret Talbot joined The New Yorker as a staff writer in 2004. Previously, she was a contributing writer at the New York Times Magazine and an editor at the New Republic. Her writing has also appeared in Slate, The Atlantic, and National Geographic, among others, and has been anthologized in The Best American Science Writing. She was one of the founding editors of Lingua Franca and was a senior fellow at the New America Foundation. In 1999, she received a Whiting Writers Award, and she's also the author of The Entertainer, Movies, Magic, and My Father's 20th Century, about Lyle Talbot, her father. Don Undine is currently the manager of the Maker Hub at Georgetown University, the only makerspace on campus serving students, staff, and faculty through community building, curriculum development, and entrepreneurial support. Dan is also an adjunct faculty for the Graduate Culture, Communication, and Technology program, as well as for Georgetown College at large, teaching courses in creative web development, social justice, fabrication, and maker culture. Prior to moving to DC, Dan was the founding manager of the Media Lab at the Metropolitan Museum of Art in New York City, an innovation center developing prototypes at the intersection of art, technology, and the museum experience. Joining the conversation today, we also welcome Luz Zhu. She's a senior at Georgetown University School of Foreign Service, majoring in science, technology, and international affairs, and is also a Maker Hub staffer. On nights and weekends, she volunteers as an emergency medical technician in Montgomery County. Our moderator is Professor Lakshmi Krishnan, the director of the Medical Humanities Initiative, a faculty member in medicine, affiliate faculty in English, and a faculty fellow of the Humanities Initiative. Her research and teaching broadly focus upon 19th and 20th century cultural history of medicine. One last detail about today's event: in the last 15 minutes, we will be taking questions from the audience, so please feel free to submit your questions through the Q&A feature. Thank you very much.
Thank you, Nicoletta, and many thanks to Margaret, Dawn, and Luz for joining us today. We'll get started immediately, and Margaret, I have a question for you regarding your New Yorker story, Rogue Experimenters, which gives us a fascinating glimpse into DIY Bio, which is the grassroots citizen science movement self-described as a leaderless duocracy. Can you describe this movement and the reasons you chose to pursue this story?
Sure, thank you. I'm so glad to be here today. Yeah, I mean, I'll tell you how I got interested in the story because I think that's a good way in. I got interested in exploring this kind of ecosystem that you referred to when I heard about something called the Open Insulin Project. And Open Insulin is a collective of mostly volunteers, some with scientific backgrounds, some not. They're based in Oakland, but they they actually have people around the country, including in Baltimore. And their goal, their idea was to reverse engineer, figure out how to make insulin, because insulin is so expensive. So they, insulin is obviously something that people with type 1 diabetes are dependent on every day. And it's a life and death matter. And as many of you may know, the cost of insulin, which is manufactured for the United States by 3 different large pharmaceutical companies, has been going up and up and up. And it's really put a lot of people into pretty desperate circumstances, and has caused a lot of people who have diabetes to have to ration their insulin and put themselves at risk of serious medical complications and even death. So the open insulin people, some of whose founders are diabetics themselves, but most are not, decided they wanted to figure out how to make insulin, make it themselves, and make it available to people at affordable or very low prices. And they've been working on that for several years. And I got interested in it. It just seemed like such a kind of remarkable idea because, I write a lot about movements and innovations, but this was kind of the first one I had heard about where, a group of people had identified a problem and their answer was not to go sort of lobby or push the government or companies to do something different, but to just make this thing themselves. And so I was fascinated by that, and I went and spent time with them in Oakland and in Baltimore, and then interviewed people about how pragmatic it was and how likely they were going to be able to do this, and talked to people who were more familiar with the regulatory structure and people who were more familiar with the biochemistry and how insulin is generally made by the pharmaceutical companies that make it. And then I started thinking, well, where did they come from? What is the context that they emerged from, open insulin? And I realized that they were part of this movement of community labs, or community science spaces, which I was completely unfamiliar with. I had, heard about biohackers who were kind of individuals, often guys, a little bro-y, and who kind of had this, sort of transhumanist, self-enhancing, self-experimenting, entrepreneurial. I'm going to make money out of this, and I'm going to make myself better and live longer. And maybe I'm going to implant something crazy. So that group is affiliated. It's part of the broader ecosystem I'm talking about, but it isn't exactly what I'm talking about now in this open insulin citizen science space. And I'd heard about citizen scientists who mostly were working to do things like, chronicle migratory bird patterns, but then, or planetary movements or whatever, but then supply that movement to professional scientists. So these were people who were working outside of and really wanted to be working outside of the sort of conventional spaces where science is done. So outside of academia, outside of corporate labs, and they had a very strong feeling that they should be doing that because science should be democratized, and that all kinds of people should have access to some of the new tools, especially of bioscience, that were available now. So I learned about a lot of these spaces, these community labs. Counterculture Labs is the place in Oakland that Open Insulin works out of. A place called Baltimore Underground Science Space, Bugs, is a place they work out of in Baltimore. There are dozens of these around the country, and people are doing real bench science. They're doing, they're working with CRISPR technology. They're doing other different kinds of gene editing. They have the advantage of there being a lot of new equipment that is actually somewhat affordable. I mean, I had no idea, but apparently like a lot of PCR machines can be used on eBay, and there's 3D printing, which we'll be talking about later, and there are powerful microscopes, and there's open source software, and there are a lot of new tools and a lot of belief in using these new tools and disseminating these new tools in these science spaces. And I was also surprised that, especially at least in Oakland and Baltimore, they were pretty diverse spaces in terms of race, in terms of gender, in terms of age. So that was impressive to me. And I guess what sustained my interest in this was, I mentioned that I've written a lot about social movements, grassroots social movements for social change, social justice, and I'm very interested in them. But this was the first one that I'd come across that had their goal was around knowledge. Their goal was around acquiring and disseminating knowledge. And they had the additional wrinkle of wanting that knowledge to be, of seeing that knowledge as being acquired through doing, through making and doing, and hands-on, do it yourself kind of approaches. So that's what sustained my interest. That's a little overview, and I'm sure we'll get into more detail, but I hope that gives you a sense of what was driving me anyway in this article.
Oh, thank you so much, Margaret. I think that gives us a good sense of the kind of heterogeneity of this space, and also your sort of wide-ranging exploration of it, which in the article is just fascinating. And one of the things you just said, talking about this idea of doing and making, is just a brilliant segue to Dawn. Because Dawn, of course, as we know, in Rogue Experimenters, Margaret refers to these movements as arising partly from maker faire and maker culture. So for those of us for whom that's still unfamiliar, can you describe maker culture to us, and then also just the ethos of the maker community and then Maker Hub itself?
Yeah, sure. Hey, everybody. Thanks for coming. I'm going to do a little bit of walk and talk, because I think maybe to explain maker culture, it's really good to show a maker space. So this is the Maker Hub. As we introduced it a little while ago, we're in the first floor of Lauringer Library, right? And I think that's important to note that we're in a campus library, because the library serves everybody on campus. And similarly, we're a maker space. It's a highly interdisciplinary, not a space for non-hierarchical peer-to-peer learning. So we have got all sorts of tools, right? You see tools everywhere. We've got a print shop. We've got, we even have an old typewriter, which actually gets more use than you might think. We've got sewing machines and digital embroidery machines, digital design workstations, laser cutters, electronics over there, 3D printers, right? So there's lots of tools. But normally, if we weren't in COVID times, this place would be full of people just working on their own projects in these different spaces, right? You might have someone in the electronics area soldering, and somebody over in the textiles area sewing. But then they would come into the central table to talk, to share ideas, and maybe they would start working on smart textiles, right? So this notion that there's not really boundaries between different kinds of making, and that all of this is technology that anybody can learn, I think is a really, is sort of a fundamental aspect of maker culture. Very much related to DIY bio, which is this idea that, like, just because you have a PhD doesn't mean you own this information, right? I can learn this attitude, I can learn anything that I set my mind to, and all of this information is accessible. And that's why they create these spaces of shared tools, so that everybody can work together. And I think that's sort of the fundamental component of what maker culture is all about.
Dawn, can I ask what, you've started to get at this a little bit, but what distinguishes maker movements from kind of hacker culture and DIY culture, again, to those of us who are neophytes in this space?
Yeah, well, I think there's a lot of gray area and loads of overlap. And sometimes it has more to do with what people want to call themselves than any real distinction. I think that, and sometimes it just has to do with, like, the types of tools, right? Like a hacker culture might be a little bit more focused on technology and computer hacking, right? Whether that's like security-based hacking or just reusing tools. But makers might also talk about hacking on an old radio or something to make it do something other than it was intended, right? And maybe makers skew a little bit more towards the craft end of the spectrum, right? They might include things like sewing and printmaking that hacker might not, but like I said, there's a whole lots of overlap. And I think DIY is very much within that umbrella as well.
Margaret describes one of these groups, Enable, which pivoted at the beginning of the COVID-19 pandemic from making prostheses to face shields, and which has distributed a lot of face shields in many, many countries. And the Maker Hub similarly pivoted to creating some PPE. Can you describe what happened, how that decision was made to make that pivot, and then challenges that you encountered?
Yeah, absolutely. And since we're on the topic, this is kind of what the Enable prosthetic hands look like. So we've 3D printed a handful of these as well. But so to put the long and short of it, about 1 million years ago, when all this whole COVID thing started, right, we had to shut down the library. We also started getting a lot of emails about PPE shortages, right? And makers are typically very solution focused. There's a problem, they want to figure out, well, how can I apply my skills and knowledge to this issue? Because it's an issue affecting my community. And I think makers are often very locally focused, right? So, but we were having to shut down the libraries, right? You can see we're kind of empty right now. So we're like, well, okay, well, we're not going to be able to hang out in the library and help with all of our maker tools. So what we did is we said, okay, well, let's get these maker tools out of the Maker Hub and into our maker community. So whatever we decide to do, at least we're equipped to do those things. So, so Luce here, also one of our Pascal Gerard, Cameron McKay, Willem Miller, all members of our community. I just want to shout out to them right now. They all took 3D printers home with them, right? And this is before we had figured out what we were going to do. But the thing that we realized is we were getting lots of emails from folks saying, well, have you heard about 3D printing? What could you guys do? Could you 3D print some things for us? And it was lots of ideas, right? And usually the maker attitude is, oh, we'll prototype something, we'll make a couple of them. If they don't work great, that's fine. We're just trying things out. But here we're trying to save lives, right? And like mistakes cost lives, right? Like we talk about failing forward and move fast and break things in this kind of community. But like when you're breaking things, you're breaking somebody's lungs, like it's not a thing that you want to break. So this idea that we were going to make some quick prototypes and drop them off at a hospital, and the hospital was going to use one of our 3D printed masks, we quickly realized, well, that's not necessarily the best idea, right? And we met with other community leaders and other maker spaces, and they're all saying the same thing, is there were aspects of the way makers and maker spaces operate that didn't quite mesh with the needs. So what happened is we had some really smart makers start looking at this issue from a supply chain and logistics point of view, which is not really a makerspace's core strength. But what they did is they said, okay, well, you can't necessarily make a 3D printed mask and give it to a hospital, right? That's not necessarily safe. Plus somebody in a hospital has to figure out, they have to decide, is this safe? And all the time they're spending looking at this thing, well, that's the time they could be actually, doing their doctor job and, being boots on the ground and saving a life. So we hooked up with a group called We the Builders running out of Baltimore. And they said, okay, here's what you can do. Here's a model for the frame for a face shield. So this thing goes right here and you hang a plastic in front of it. And so they provided the model and say, we've confirmed this with some doctors that this is something that they can use. Lots of maker spaces can make these on a 3D printer, but they do need, I got it right here, right? Like the plastic part that goes in front, right? So this is sort of a completed face shield. Now maker spaces don't often have access to this kind of material, and at the time it was hard to obtain. So what We the Builders did is said, okay, all you 3D printers, make these. Here's how you clean your equipment. Here's how you package it. Here's how you label it. Here's where you ship it. And then they took all those things. They added the clear face shield. They bundled them into, sets of, groups of hundreds of them and would deliver them to hospitals. So the hospital only had one organization to worry about in terms of getting these things. And so while we batted around a lot of different ideas for things we can make, and I've got some examples I'm going to show in a bit, what we decided was the most effective use of our time was just to focus on this one thing that was going to let us do what we do best and let the doctors do what they do best.
Thank you, Dawn. And this is obviously about to open up some really interesting avenues for our discussion shortly, but I want to turn to Luce now and ask you, Luce, how you got involved with Maker Hub and what it's been like being part of the Maker community.
So I got involved in the Maker Hub my sophomore winter. I kind of wandered in. I was trying to make Christmas presents for my siblings, and Maker Hub, both college students, I want to make them something nice, but don't have the money. So the answer is, make it yourself. And then so the Maker Hub has this wonderful policy that we call DIY, not DIFY, which is like when we have people come in to learn stuff. Because so it's not just people who know how to use all the random tools we have there. Like we can have somebody who's never done any of this before walk in, and we have trained staff and volunteers who will teach them how to do stuff and make whatever they want. But the principle is we don't make it for them. Not it's do it yourself, not we do it for you. So we show them, okay, this is the button you press to run the 3D printer. This is how you thread the needle, but we don't do it for them. So I was just learning how to kind of make stuff. We had staff and volunteers that showed me, and I just kept coming back, and by the end of the semester, I was like, wait, I know how to use most of the stuff in this space. And I spend enough time here anyway. I might as well start volunteering.
That's so fascinating, Luce. And you wear so many hats, which I'm fascinated by too, because you're also an EMT, as we heard from Professor Peredu. You were a student EMT, are a student EMT during COVID-19. So can you talk about that experience, and then we'll kind of come back to the...
Yeah, so in hindsight, I really should have seen COVID coming more than I did. We were getting emails back in January about, oh yeah, there's this weird respiratory pneumonia coming out of China. We kept getting emails, it kind of came, and we got some more emails in February. And then by the time we hit March 1st, we're like, oh, right around the time when it started hitting domestically in Washington State, was the first nursing home outbreak and the first responder outbreak, because there were a number of firefighters and other first responders who were infected from the initial nursing home outbreak. We're like, this is a problem. Uh-oh. And then so that it was kind of proceeded on normal. They started telling us, okay, now for every single call you go, even if they're not sick, with flu or whatever, you have to wear a surgical mask. And then they started telling us, okay, if it's a COVID patient, you need to start wearing N95. They started bringing in all this new PPE stuff. And then Georgetown sent us all home over spring break. We all remember that as students. And then it just and I ended up staying here because I needed to be able to commute easily from campus to the station, which is a little north of campus, about 30-minute drive. And then so that just kind of melded into spring semester. I wasn't on my classroom, on my laptop taking classes. I was at the station. We started worrying about running out of PPE. We had a little inventory count on on our little big whiteboard at the station. This is how many gowns we have. This is how many surgical masks we have. This is how many N95 we have. We don't know when the county's going to give us more, or the state's going to give us more. And yeah, so it was super interesting. Definitely something to, tell grandchildren or something about.
So, and while you were having that experience of seeing the kind of PPE clock run down, how was it to then be part of this process of making PPE through Maker Hub?
It was super interesting. I cannot remember when this happened. At some point, all the nights blend in with each other. It's 1 o'clock in the morning. You don't really know what day of the week it is anymore. But I remember we were running a call with another station. It wasn't one of our cots. But so 3D printed material, the product, they have a certain distinctive pattern to them. Don, I don't know if you have something we can show them, the little lines. So I'm not sure if you can see it through the screen, but there's little tiny lines of stacked stuff. If you took cardboard and smushed it together, you can still see the individual cardboard and think of that on a millimeter level. So 3D printed products have a really distinctive look. And we're running this call to another station and on the back of their card, I see two 3D printed frames. They're sparkly purple and sparkly blue. And I was like, oh, huh, cool. Couldn't get a picture because I didn't have my phone on me because I left it in bed, or it was just in my pocket underneath all the gowns and stuff. But I was looking at it, damn, I wish I could get a picture of that. Because it was actually cool seeing a 3D printed product, just running into it on my not night job because I'm not paid, but night hobby.
And, you know, on the topic of PPE, Dawn, I know you've prepped a mini demo for us of the process. So can you talk us through that?
Yeah, so I did this sort of Julia Child style, right? Oh, fantastic. Oh, and you get to see another awesome factor in 3D printing, right? Which is the fails. And Luce probably lots of stories about 3D printers that don't do what you expect. So these are the 3D printers, right? They're made by Ultimaker, who donated to us a lot of the filament that we used. And basically they work by spitting it. I'm sorry, but I thought this was going to be going fine. But so this is what the print looks like right now. So if I can show you guys, right? So Luce knows what I'm talking about. That's not what 3D printing is supposed to look like. That's what we call a 3D printing fail, where the filament gets caught up in the nozzle and is now just spewing garbage all over the print bed. But if it had worked, you would see the printer printing really thin layers of material. I'm gonna go ahead and hit abort on that so you can see what that garbage looks like. But then when it's done, so this part works, is you get a print that looks like this, right? And you would peel it off the print bed, and right, and it has this little excess material on the side that you would peel off, and then you would get your final version that looks like this. And that whole process takes about 4 hours. And you could maybe do a couple of prints at a time and do a print in about 5 hours or so, but it's not fast. So you kind of gotta just sort of keep at it to build up any sort of quantity. So that had been a problem. But we have also, since then, we've also been making some other things, right? This is nice. It's a door opener, right? You can push buttons with it or pull door handles to keep your hands off of things. This is nice because this doesn't have any medical requirements. So that's a nice thing about it. We started experimenting with these 3D printed masks. These are nice. You can sort of heat them up and mold them to your face, get a nice custom fit and install filters. So these work better than, theoretically, again, better than cloth masks. But these things are not medically judged or approved, right? But of course, neither is my cloth mask. But one of the fun things about doing this stuff in a makerspace is the opportunity for personalization. So we started making neat, and this has got an embedded filter, but it's like a Darth Vader face printed in white plastic. We're building smaller things as well. This is an ear saver, right? For those masks that go around your ears. This goes on the back of your head, and you put the straps around this instead of your ears. It makes it more comfortable. Also, it's got Wonder Woman on it. And of course, you could paint this after the fact, and that would look really nice. So that's a handful of the things we've been making here. I'm going to shut off the printer now. And so you can see that this would have been a really nice looking print if it wasn't this goopy garbage. So again, this is where the rubber meets the ideals and hype meet the reality, that 3D prints don't always work out, and you got to account for that when you're making things. Also wanted to share this other printer. This is a Formlabs resin-based 3D printer. It uses a very different process and different types of materials. So you can actually make objects out of medical grade resin. So we can use, oh, here we go. Right, so this creates material in a much smoother kind of plastic that you could actually put in an autoclave, non-bioreactive. So these were used for making nasal swabs when Italy was running low on those big brain scraper nasal swabs that everyone was afraid of in the beginning. Now, again, we could do that here, but we're not a medically rated facility. So even though the tool itself might make things that are medical quality, our space can't, right? So we're always eager to work with folks who want to prototype products for the med school. If anyone out there is listening and they're interested in working with us to prototype things, we're eager to partner up with folks. But it's clear, it's important to be clear what the limitations are of spaces like this, and so we can balance the hype and the opportunity with a bit of reality.
Thank you for that incredible demo. even though I've had the benefit of seeing a little bit of it before, it's still really exciting to see it and to get that kind of visual of touring the space. And I look forward to, you know, being able to come back to the space and actually explore it too. And thanks Luce also for sharing, you know, those stories, especially of the early days being an EMT during the, you know, the beginning of COVID. And, you know, Dawn kind of gestured toward this, but at this point, I really would love to open up the conversation between the three of you about some of these broader questions that Margaret gets into in the Rogue Experimenters, and Dawn mentions the balance between the hype and the kind of reality. And some of these are, you know, it's a mix of thinking about the ethics of this, the regulation of these processes, and then also being future oriented, especially as we get through and look to a life post-pandemic. One of the things that your article highlights, Margaret, is this tension in modern healthcare delivery, right? The misalignment between the provision of care and scientific investigation and discovery, and that some of these citizen scientists or DIY biologists or makers are attempting to fill that gap, which clearly could have impact on health equity. But then you also outline some of the counter arguments made by a number of people that our energies would be better focused on remaking our political structures or remaking a broken system. Whereas there are others who lift this up as a kind of quintessentially American hustle and grind project. Can we just have a conversation about the three of you and your views on that topic? And maybe we'll just start sort of in the same order, but feel free to interject.
Yeah, I mean, I'll jump in because I love that question. I mean, I love also, you know, the ethos in this community of we see a need, we're going to step forward, we're going to try and make something. There may be cases where something is better than nothing, you know, it's not for example, in the case of like Enable, the community you mentioned that makes the prosthetics, they're not going to be medical grade prosthetic devices, but if somebody is uninsured and they can't afford a hand at all and they get a lightweight plastic hand, it's going to be very, very useful to them, and they're probably going to appreciate it. And actually, in their case, I think there's some children who I talked to who actually like the lightweight prosthetic hands. They're cool looking, they're bright colors, they look sort of like superhero hands, and they are kind of useful for interacting with your peers and being like cool, you know, different in a cool way. But you know, I think to the broader question, I think honestly a lot of what some of these groups and efforts do, Open Insulin is a really good example of this, is it's in a way a critique, you know, that something like this has to exist. It's a critique of our system, that there are people who are saying people are dying because they can't afford insulin, so we are just, you know, I don't know, let's make some, you know. I mean, there is a little bit of a it's admirable, it's ingenious, and it's also a little desperate. And there were people I talked to, including a wonderful guy named Greg Gonsalves, who's a professor, a public health guy at Yale, and he had been very active in ACT UP, and so he is somebody who has a history of, you know, doing kind of confrontational, radical kinds of things, but he really felt this was, you know, a waste of energy, the open insulin approach, that they should be, you know, demanding that there be, you know, that the pharmaceutical companies bring the prices down, or that we have, you know, healthcare for all, that this would not be an issue. And so this was sort of like this ingenious hack for something that shouldn't be a problem at all, and that we should be attacking as a society and fixing as a society. So I think that's a good critique, and worth looking into, or worth considering pretty seriously. I also think that there's a way in which, with some of these groups that are very close to the communities, the patient communities they come out of, that can be very useful because they're sometimes in communication in a way that big bureaucracies or certainly our healthcare system as it's set up now isn't. It's just not set up to listen to what people need in that way. And that's particularly true if you're dealing with a well, it can be particularly true if you're dealing with a rare disease. And, you know, some of the most successful kind of citizen science efforts I've heard are, you know, parents who have children with a very rare disease who went out and did the research themselves. And in one case, a remarkable woman named Sharon Terry, who had no medical background, and as somebody I interviewed for the article, she was a college chaplain. Her children, her two children had this very rare genetic disorder called PXE, and she and her husband, who also had no scientific background, ended up discovering the gene that caused it. And, you know, this came out of her frustration as a mother because she had two groups of researchers coming to her house and wanting to take blood samples from her children. And she kept saying to them, why do both of you have to take blood samples? Why do they have to be, you know, poked like this by two different teams of scientists? Can't you collaborate? And they would say, no, we're from two different universities, we're competing essentially. So she was very devoted to the idea of making this information available to the patient community of people who had this disease. And so, you know, it was a powerful motivator, and it made a huge difference. Or in a much more kind of you know, engineering kind of way, there are the people, the diabetics, who have come up with closed loop insulin delivery systems, sometimes called artificial pancreases, that basically are, you know, they worked with software, they developed an algorithm to determine when your glucose levels were low, and they figured out a way where you could actually, you know, a pump could deliver it automatically in the night in response to these levels. So, and patients have done that too. So I guess I would say that that's one of the more successful kind of strands of this movement, is places where there is a lot of accountability and a lot of communication with the patient community that has whatever the you know, the solution is for.
That's a good point. I was thinking when I was reading your article, Margaret, there's an interesting distinction there in terms of how we process this, as whether it's a systemic issue or whether, you know, maker culture and DIY culture is really the right approach. Is you know, the difference between things like the DIY insulin movement, which really seems to have more to do with like systemic problems, right? Like it's expensive because we have crappy medical care, and it kind of makes me think about the, you know, GoFundMe pages for people's surgery, right? Yes. Like what a tragic thing that is. That in America we think that that's a great thing to contribute, you know, that has to exist. Versus those things that in the maker culture we might call mass customization, where there's a very small number of beneficiaries of a technology, and there's not enough, and from the point of view of scale, of economies of scale, there's not enough need in terms of number of people for a solution, and a DIY movement kind of is a good approach for that. Similarly in a maker space, right? Like making I can make one or two custom plastic things, right? Cheaper than I could make a dye and send it to a factory to make, right? Because it's like $15,000 startup fee to get an injection mold, right? With that, I could make, you know, 100,000, but if I only need 4, it's cheaper to make it on a 3D printer. So in one sense of the scale, it's sort of indictment of our system, but on the other scale, it's actually an opportunity for DIY culture to really make a difference. And I thought that was I hadn't thought about that distinction before I was reading your article. I thought that was really cool.
Yeah, well, thank you. I definitely, I think that's right. And I mean, there was a guy I spoke to, a biochemist, who had written about open insulin, and he said, you know, I love that they're trying to do this, but really it doesn't make sense for them to do it for insulin. There's an enormous market for insulin. Insulin should be as cheap as Tylenol. The pharmaceutical companies should bring down the price, or you should have price controls on it like they have in other countries. I mean, insulin is not this expensive in other countries. It's not this expensive in Canada or in European countries. So, you know, and as opposed to the sort of rare disease model where, you know, it's going to be a very small number of people who need a particular medication, and it may not be, you know, it may not be in a pharmaceutical company's interest to develop something that's going to be used by, 1,000 people. So yeah, you laid that out very, very well, and I agree with you.
Yeah, interesting enough, I've been on both sides of it. Like, I'm in a maker community. Like, Don can tell you, ever since I, started figuring out how to use 3D printers, they will change your life. I've printed everything from cookie cutters to, little rings for your shower curtain. It's just like the little stuff, why buy it on Amazon if I can just pop down to the driveway and, print it myself. But I've also been on the other end of this. I read your article too on Margaret, and I haven't had that much experience with insulin because that is the hospital's problem, not our problem. We can't give insulin. We can give sugar if the sugar's too low, but insulin is not our problem. Not our problem, but it's beyond our capabilities. Like, definitely a problem, but we can't solve it. But I feel like EpiPens go. Like, EpiPens are atrociously expensive. And a lot of the expensive to the point where a lot of EMS organizations, they don't buy EpiPen for when they need epinephrine for anaphylactic, for an allergic reaction. Instead, what happens is they buy the little vials of epinephrine, epi we call it, because it's not the epi itself that's expensive, it's the injector that costs patented or something or another. And then it's just cheaper for us to buy epi and then just draw it ourselves with a syringe and a needle and just inject it in the patient. And it's a general standing policy. I'm not aware of an official protocol, but if we are running a patient who is having an allergic reaction, we just use our epi instead of theirs because we have epi, we leave them with their own EpiPen because it costs so much money for them to replace. So on one hand, I really sympathize with the whole, making your own medicine. But I've also been on the other end of home remedies and stuff. And I've seen the medical, well, not seen, I've at least heard third or fourth hand of the medical consequences. Nothing on a maker community kind of scale. It's more people look up home remedies on the internet and they try it themselves and turns out that wasn't a good idea. I heard third or fourth hand involved a guy who had some STD or other. And then he read on the internet that garlic was a home remedy.
Oh no.
He applies it to the area of his discomfort. You can imagine what happens when he calls 911 2 days later.
Okay, that story is going to stick with me. I'll warn you here, and I can't unhear that now.
We're haunted by that story, Luz.
The idea that because there's a need for this, but on the other hand, there is oversight is needed for a reason.
Absolutely, and I mean, mentioning the EpiPen, yes, EpiPens are unconscionably expensive, and it's the delivery system, it's the syringe, it's the pump, not the, as you say, not the epinephrine itself. And one of the people I interviewed for the article is a guy who is a sort of anarcho-libertarian guy named Michael Laufer, who has something called Four Thieves Collective, and Four Thieves Vinegar. And he, one of the things he did was to put instructions for making an EpiPen online, and that isn't technically illegal because he wasn't selling EpiPens. So actually the FDA didn't come after him or anything. But he had an attitude of sort of, well, we don't, people can do this or not do it. It's not our responsibility what happens. But people should, be brave. They should do it. They should try it. And, I think that's a particular attitude that a lot of people don't have and wouldn't want to be widespread, not only because it would, perpetuate all kinds of unsafe solutions at times, but also because that's a kind of heroic individualist kind of approach, that I don't think, people should have to make their own EpiPens. I mean, that's kind of he had a kind of, I'm on the cutting edge. People who are on the cutting edge will do this, but that's, that's really not for everybody, and it shouldn't have to be for everybody. So
yeah, I'm looking at that example and I'm thinking, it's awesome that he put out an EpiPen, on it, instruction to build on the internet. But say a parent, she has a kid who has a bee allergy, a peanut allergy. She uses that. How does she know it's gonna deliver the appropriate amount of epi. Like, you don't deliver enough, you know, you can't eat something, you give them an EpiPen, and then, you know, you think they go to bed, and like, you know, half an hour later, there's not enough epi, they're going back in anaphylactic shock, and you're fast asleep because you thought they were going to work.
Right. Yeah. Right. These are life and death matters. So
I think we see what happens right now when people think that they know medical things that they don't, right? You got half the country thinking they know the masks aren't useful, and that, I don't know, stereotypically American attitude of I'm my own expert is only useful if you're actually an expert. It's not useful if you think you are an expert but are not.
Right. Right.
Yeah, Don, these issues of verifiability, veracity, communication, transparency, and then regulation, which you're all bringing up in so many interesting ways. And I guess, you know, thinking about this and asking the three of you to forecast a little bit, looking beyond, if we can get beyond, right, this pandemic, what do you think it means for these movements? You know, which have been kind of hailed as potentially creating this sort of cooperation and transparency in science, which is badly needed. Again, any thoughts on that?
Well, I mean, I'll be a little optimistic and say that, you know, I think the sudden need for a lot of information, the sudden need for a lot of PPE, and the model of people stepping forward and trying to fill those needs, I think could have a good effect on sort of mainstream science and medical technology. I mean, I think the idea that, you know, more protocols should be open, more papers should be out there, perhaps, you know, pre-publication review, more sort of reagents and other things that are needed for scientific experimentation should be more openly accessible. You know, journal articles shouldn't be like horrendously expensive for anyone who doesn't have an academic affiliation. You know, maybe some of those notions of sharing and openness and transparency, I hope, that was the hope of some of the people in the community I talked to, especially people who kind of straddle both worlds. They hoped that there would be this kind of positive influence from the kind of citizen science space, which is very dedicated to openness. And I think that's a good value, and I think it may, especially in the kind of crucible of the pandemic, it may have some lasting influence on mainstream research, I hope.
I mean, I think if these kinds of movements can bring about or bring to light the need for systemic change, I think there's like that's one kind of value, right? And then the other kind of value is spaces in which DIY bio is the answer, right, for these low scale factors. But I guess my concern, right, is when DIY, whether it's in maker spaces or in bio, is seen as just sort of like a cover, right, a nice story to make us not think about the necessity of that systemic change, right? Like if I'm donating to someone's like GoFundMe for their cancer, for the chemotherapy, we should also be using that story to indict healthcare system, and not just say, well, as long as we have these nice stories about people getting the care they needed through these DIY things, we can ignore that for every one of those people, there's like 1,000 others that aren't getting anything at all because there's a systemic problem. But we've seen with 3D printers, right? What happened is the cost of 3D printers has gone down so much that it's really changed the nature of who has access to this technology, right? So we see, kids in bad educational environments, but still getting access to things like 3D printers, teaching themselves engineering the same way cheap software is helping young people learn to code on cheap computers. We've got people getting access to opportunities to really become, professionals and change makers that might never have had access to this technology or in the past. And I think you can't give too much, too little credit to that, right? Like, I'm bringing in a kid into a DIY space who doesn't have anything like that in his elementary school, middle school, high school, and they start to think, wow, I could become a biologist because, oh, I get it. This is something that I can do, right? As a gateway, I think it's also fantastic. I mean, the maker communities are very much involved in STEM education. So I think always trying to figure out how we can give more people a leg up into this kind of work by showing that it really is an accessible technology.
Yeah, I was just to respond to that. I mean, I do think that's really part of the ethos, especially of some of these, community labs that sometimes are affiliated, like the one in Baltimore, Bugs, that I mentioned, with schools in the neighborhood, and, have teams that do the iGEM competition for, genetic engineering projects, but they don't have to be school-based, so you can be part of a scientific competition, scientific project making, but you don't necessarily have to go to a school that has a great program for that. I mean, again, would be nice if all the schools had great programs for it, but also to fill a need, when that isn't the case, I think they do really, they have stepped into a breach.
I mean, from my experience, the medical community tends to be very risk adverse, at least from what I experienced. It takes a long time to change something, they study it, not to death, because they really want to make sure this thing is going to do no harm to the patient before they even think about remotely considering a study to change the protocols to authorize this. At which point, they'll take another 5 years. But organ transplants have only happened with the first one was still within a lifetime ago, less than 70, 80 years. I think the first organ transplant was in the 50s, and now we have scientists studying, trying to figure out, can we theoretically 3D print an organ? So I mean, hopefully, it's not going to be fast, not going to be by the time I finish graduating college, but hopefully at some point, the intersection of caution and these new ideas and more accessibility and openness for everybody can change medical, the whole interaction of humanity. I mean, I'm sure if you told the people who first thought about an organ transplant in the 40s and 50s, hey, within your kid's lifetime, easily, or technically, you could be trying to print organs. You're like, what do you mean by print? What printing?
True.
Thank you all for these thoughts. This is, I think we're at the point where we can start to open it up for questions from our audience. And so I would encourage folks to go ahead and start putting questions into the chat, into the Q&A. And as those are populating, perhaps I can start things off by asking one of my own, which is a short question, but one thing that I was really struck by, Margaret, as I was reading Rogue Experimenters, was wanting to know more about the actors inhabiting these spaces. And you describe them in so many interesting ways, like there's the bro-y kind of biohacking type, there's the anarcho-libertarian types, range of political ideologies, range of identities. Can you all speak to that a little bit? And meanwhile, our audience will send us some questions.
Yeah, I mean, as I say, when I first started in on this piece, I think I knew about, not to reduce people to types, but, I was sort of thinking of two types of people, the kind of like Josiah Zahner, who's like the biohacker guy who, has done fecal transplants on himself and, injected himself with CRISPR technology to supposedly enhance his musculature and, all live streaming. And he has a company now that, sells glow in the dark yeast and where you could use CRISPR technology on tree frogs. And, he's like, it's all sort of like mad science, and so there's that type, and there is a sort of bro-y element to that. And it does tend to be mostly male and mostly white. And then there are people who are kind of more, and And those people also kind of merge into the anarcho-libertarian world a little bit, and they also include people who are interested in doing various kinds of implants. So an implant where you have your passcode in your finger and you push the door and it opens automatically, or where you have your medical history, your EHR, essentially as an implant in your arm, or you might have an implant in your eye that makes you see in different colors, or whatever it might be. So it's that kind of self-experimenting mode. And then there are people who are much more, I would say, sort of oriented to, helping others and to kind of social justice. And that's sort of the open insulin people, the enable people. And these people, I was sort of surprised the degree to which they actually do communicate and collaborate, because they struck me as kind of culturally and in their value systems fairly different. But I think that notion of, we want to do science and we think we should be able to do science outside of and make stuff outside of the conventional spaces does unite them. And so they do go to some of the same conferences and they do talk to each other. And there are people who think of themselves as, well, we're part of this kind of mutual aid social justice tradition, but we're also biohackers, so that was interesting to me, that there was kind of more communication. I was expecting to hear more kind of dissing of the other camps within it than I actually did.
That's really interesting. It kind of reminds me of a story that I like to share whenever we're talking about what maker culture means, this notion of culture around these kinds of practices. So in Belfast, there's a makerspace, blanking on the name, Nerve Center Belfast, that is constructed at the intersection of Protestant and Catholic neighborhoods, right? And it's expressly designed to bring together Protestants and Catholics from across this divide to make things together. So literally you got people who, otherwise might be fighting in the street and trying to kill each other, working on making projects, right? And building bonds through that. So that's just to say that, despite people having differences, there's an ability to just sort of geek out, right? And on a thing, on a process, on a project that is, I don't want to say politics neutral, because there's a type of politics behind that, but it does allow people to sort of bridge that gap and see each other as human beings with deeply shared interests that run very deep, and there's a real value to that. And when I ran the makerspace at the Metropolitan Museum of Art, well, my job was bringing together curators and new media artists, traditional curators of antiquities and new media artists, to get them talking. And we found that if you just let people who are geeks geek out together, they become friends, even if their geekiness is directed towards different things. And we got all of our best projects from putting curator of ancient Egyptian art together with person who 3D prints in porcelain, develop projects together. So there's that aspect of it. And I guess I want to say, because maker spaces who are trying to survive tend to have some sort of workshops that are community focused, or connecting to schools, or STEM education, or K through 12, to pay the bills essentially. I recognize that to do that work, they need to speak the language of the communities and education, which requires, that they are thinking about their behavior and their language around diversity and representation. And I don't know if chicken and egg scenario, right? I've definitely been in maker spaces where people, it would seem to be mostly dudes trying to figure out how come there weren't more women in their makerspace. Makerspaces break up over the labeling they put on their bathrooms. But what we see is that these conversations are happening. That if you're going to be a makerspace that has an orientation towards the public at all, you can't just pretend like that issues of representation don't exist. That you have to really have some frank conversations. I know friends who have run maker spaces, they came into them and they were very broy and wondering why they were failing. And my friend had to go in and kind of chase some of those people out just to create a community that really, a space that could really represent and serve the community that they were in. So I see the conversation happen a lot around that, and also around the kinds of tools that are in maker spaces, right? Like a bunch of engineers start a maker space. They might have a CNC lathe and a metal shop and electronics and 3D printing. But then you start having conversations about craft culture and the intersection with craft culture. And I don't know if it's necessarily there's gender things going on there, right? Not to say that only women sew and only men do 3D printing. That's completely untrue. But there can be perceptions along those lines, and there are cultural distinctions, and there's a fight for representation of tools within a space and making traditions within a space, in addition to other kinds of cultural disputes that go on. So you usually see sewing machines and crafting supplies in community-focused maker spaces more. If you're in an engineering school, you might see less of that, but it's definitely an ongoing conversation. And even the term maker has been brought under some scrutiny from folks, particularly in the crafting movement, who are saying, like, why is it only the creators that get respect in this culture? What about the nurturers? What about the people who maintain, care for, who clean, who support? They deserve as much respect and credit as those who, create and build things new, right? Like, there's a lot of value in sustaining something that's working, or gradually improving something that needs help, than just, moving fast and breaking things.
Thank you, Don. Luce, I'm going to invite you to close this out, and then we have some excellent questions to start fielding.
I've honestly never thought that deeply into the politics, like political stuff of maker spaces. Like, Don can tell you like how much like I'm not that political, and like especially like applied to the maker space. I mean, it's super interesting to think about. I just don't have thoughts on it right now because this is literally the first time I've thought about it. And as an EMT, my job is just to keep my patients from dying until I get them to the hospital. Yeah.
On that worthy note.
You're a maker and a maintainer.
Mm-hmm.
Exactly. Nicoletta?
Yes, we have two excellent questions. One that could be addressed to all the speakers and one specific for Margaret. So I go with the first one. Where do you see the maker movement play a role outside of the health or medical field during the pandemic? So we'll start with this one and then I'll reveal the second one.
I'll speak to that first, I guess. I've worked really hard to try to make my job continue to be relevant when I can't have anybody in a makerspace. I think my bosses are listening right now. We have been running a variety of making from home workshops, helping people see that the community is still active, right? So the people, we'll still care about each other. We still check on each other, right? Even if we're not making anything, we want to know how everybody is doing, and the friendships that have been made in the space still matter. Additionally, we've done workshops on how to bake a chicken, right? How to make nice printed cards at home. We've done a variety of bookbinding with home materials. We've assembled documents on okay, you think you can't make anything in your home. Let's do an inventory of all the stuff in your house that you could use as making materials. Like aluminum foil, is a wonderful tool for modeling. We do sessions with classes on, turning ideas into objects, right? Because Georgetown is so much work at Georgetown is conceptual. We talk a lot about embodying arguments by making physical objects. And so we'll do lessons on, okay, well, yeah, go through your kitchen. A spoon kind of looks like a face, and Maybe you've got some popsicles in a drawer, your little sister's Legos. So we've tried to continue to make that relevant. So I would say one of the areas where makerspaces have value, something that people need so desperately now, is that sense of community, right? The sense that you're not alone. You're staring at the walls, going from Zoom meeting to Zoom meeting, making something physical that you can take away after you've had an online session. It's kind of like bringing those people into your room physically with you. I mean, you can't give them a hug, but at least you have something that you made together. And I think that there's a value to that, emotional, spiritual value to making things together, even if you can't share the space. And it's been great to, definitely been a lifeline for me to have the maker community to be involved with during this time. So I'm not just sitting at home alone in the Zoom screen. And for those of you who are doing that right now, my heart goes out to you guys.
Yeah, I mean, I think that sounds great, and I want to like sign up for all those workshops. But I feel, yeah, I mean, there was such a surge of kind of desire to wrest some sense of control or mastery, or just palpable completion of something that you could do, in the world, that I feel like it really, from the beginning of the pandemic, and I feel like it really fed all those sourdough starters. I know more people who really had no interest in baking bread that I know of prior to the pandemic, who have gotten really into baking bread. And, I feel like there is something about like a process where you start from nothing and you come out with something at the end, and you did it and you made it, that is very comforting and fulfilling, especially now. So I did a piece for the New Yorker a little while ago about boredom during the pandemic, and what boredom is fueling. And one of the things it's fueling is this desire to make things.
A little bit of control in our lives. Right?
Yes, exactly.
Control.
I mean, long-term wise, I'd like to think, 20, 30 years from now, like maybe not every house, but like, a decent percent of houses will just have a 3D printer or some, a Formlabs, or, okay, laser cutter's a little big. Maybe they can like make a mini laser cutter, like mini printer, like just sitting in their living room. Like I had one that's kind of whirring away in the living room the whole weekend. It was like, taking between prints, just, if you need one of the things I print a lot from 3D printers is little custom cookie cutters. Like I want to make a dog treat for friend dogs. 3D print one takes like an hour, and then just stamp, have tray full of dog treats. And I know one of the other printers, in the weird aspects of domestic life with your laser cutter in your living room that you don't think of. He had to make like a little saran wrap screen for the front of it because his cat kept trying to at the little nozzle as it spun around, and kept trying to climb into the thing. So,
I do love the idea that you were talking about before, Luce, of just like, and what you're talking about now, of just like being able to concoct things that you need. Like that seems very liberating to me, that I wouldn't, when you mentioned shower rings, it was like, yeah, I actually just ordered some shower rings from Amazon, and I was furious at myself for ordering yet something else from Amazon. And if I had just been able to like, whip them up in my living room, I would be so happy.
Yeah, so I mean, long term, I feel like that, it's not a grand, inspiring, saving people, but I mean, it's something interesting to think about, long term wise, where do we think this maker whole thing, gonna come out in?
Yeah.
Thank you for these exhausting answers. Here is the second question for Margaret. We have talked a lot about making. Margaret, could you talk a bit about reporting and writing as generative activities, especially long-form, science-focused features during a pandemic?
Thank you. That's a great question, and it's and no one's ever asked me that question exactly that way, and yet it's really how I do think of my work. I actually really do like to bake, and I sometimes think a story is much like that. Just that you really the satisfaction in the process is in the thing at the end, but it's also in all the collaboration that goes into it. And I love this kind of long form reporting. This is kind of my favorite kind of reporting to do. I do a huge number of interviews. I try and listen really carefully. I love being invited into people's lives. I feel it's a tremendous privilege. I really try and do my best with people's stories. I really appreciate when they share their stories and their visions and their politics and how they think of their lives and how they think of what's meaningful in life. And a story like this, where I talked to many different people in different aspects of this movement about not only what they were doing, but what it meant to them in their life, was just I always think of it as a privilege, that people share that with me, and that I try and as accurately as possible, as fully as possible, bring it out. And the New Yorker has an amazing system of editing and fact checking. And so, everything that goes into story, every person that's mentioned gets a second call from a fact checker who goes through it and not only talks to them about their quotes and the information, but tries to give a sense of how they are slotted into the story so that they can sort of say, well, I don't want to be representative of that, of that trend or that phenomenon. And, then there's sometimes back and forth and discussion about it. And I may, in the end, don't, sometimes, especially if it's a person in power, a political person who's trying to shape the narrative, you may resist that. But other times I do think of it as a very collaborative process. And if someone brings a point to me, about the point that they have been kind of adduced into making, I try and really take that into account and maybe reshape the narrative around it. So it is a making process, and it is a collaborative process, and and there's a lot of care that goes into it at the magazine, which I am extremely grateful for, because a lot of places now rush, there's a lot of rush to get stuff out. There has to be, and I feel like it's a very artisanal process still at the New Yorker, and a lot of care goes into copy editing, fact checking, etc. So I don't know if that exactly answers the question about the pandemic. I will just say that I face the challenge now of really having to go out and do reporting again. A lot of my reporting is really based on traveling, going to visit people, going to sit with people, going into their homes. And I haven't had to do too much of that yet, because I had a lot of stories where the reporting was sort of in the can, but now I'm going to have to be going out again, and that will be a challenge. I did some reporting on Black Lives Matter demonstrations and went to those in DC, and that was fine because everyone was masked. But it'll be an interesting challenge to do some reporting in the coming months, going back out there. I hope that answers the question.
Thank you, Margaret. And, I would just like to say thank you all also for this kind of meta narrative of what the humanities can do in conversation with other cultural practices, and with science, with maker culture. And this idea of writing research long form pieces as artisanal is something I'll certainly carry with me after today. So thank you. I would like to offer or ask all of our panelists to offer closing remarks in the time that we have left.
Sure.
Okay. You want to go first, Dawn?
I'll go first because I'm more shameless. Library.georgetown.edu/makerhub is our website. You can find us on Instagram at GU Maker Hub. And we have a Facebook group, Georgetown University Maker Hub, that you're welcome to join as well. We post workshops on our website on a regular basis, and we encourage everybody to check that out. We have a Slack channel that everyone's welcome to join for detail-oriented conversations, and we really are also eager to partner with anyone who's interested in prototyping COVID or non-COVID related solutions in our space. We do making as a service right now because we can't really DIY. We will DIFY at the moment. For as long as our Georgetown community isn't able to come in and DIY. So please feel free to reach out to us, makerhub@georgetown.edu. I'm going to throw some of this stuff into the chat if that's all right. And shameless plug. Thanks for having me. It was really great to chat with you, Margaret. And
oh, this has been great. And I actually was going to read somebody else's words for my closing words, which is from something called the Biopunk Manifesto by Meredith Patterson from 2010. And it's something I quoted in my piece. It was a speech she gave that has been very influential in the movement. She says, "We reject the popular perception that science is only done in $1 million university, government, and or corporate labs. We assert that the right of freedom of inquiry to do research and pursue understanding under one's own direction is as fundamental a right as that of free speech or freedom of religion. We have no quarrel with big science. We merely recall that small science has always been just as critical to the development of the body of human knowledge." I found that inspiring, so I thought I would leave you with that.
Piggybacking off what Don said, check out the Maker Hub virtually. It's an awesome place. It's very empty right now and makes Don and I very sad because we're used to it being filled up with people. And I got a very last closing remark because the holiday season's coming all up. A little maker related because we had to make a little studio to carry out this demonstration. For your good and for the good of your local fire department, please do not put water on a grease fire. This is why.
Going. All right, go for it.
Oh!
No time to cup of water. Go.
thanks for that PSA.
Wow.
For your safety, for Thanksgiving and Christmas and Kwanzaa, Hanukkah, whatever you celebrate, do not put water on a grease fire, please. Cook, all that, but no water on grease fire.
Public service announcement.
Awesome.
Lakshmi, do you have remarks? Otherwise, I jump in with my closing ones.
No, I would just invite Nicoletta to bring us home with some closing remarks. And again, thank you to everybody. That's all I can say.
Thank you so much to our fantastic panelists for such an engaging conversation. As closing remarks, I want to add that your observations and your work invite us to appreciate the productive connections between making things, making communities, and making sense. Moments of crisis like the pandemic or the broader leadership void in healthcare, where you, Margaret, situate your investigation, are magnifying glasses that foreground underlying socioeconomic disparities, but they're also occasions for openness, for cooperation, and for communication. In the era of immateriality, of digital technology, of the ephemeral, concrete matter and the use of hands return, as we see from the activities of the Maker Hub, and return at a conjuncture like the COVID-19 crisis, where the sense of touch is lost because physical contact is remarkably restrained. And so I see a kind of strange irony in the production of PPE, for instance. They are objects that reinforce distance, separation between individuals, but their function is to save the community despite its apparent rarefaction. So they are the fruit of solidarity, of working together to benefit the collectivity. The examples of making together that we have seen tonight break down barriers and show the power of diversity, diversity of thinking, diversity of tools. Innovation comes precisely from a plurality of vision and skills that coexist and interact. The challenges we face, as you have shown us, are complex. And I think that just as biodiversity helps nature, in society, when it comes to problem solving and thinking outside the box, human diversity wins over individual ability alone. Through all our speakers tonight, we have seen making at work both in the sense of techne, concrete activity, context dependent, bound by necessity, and of poiesis. I'm thinking of writing in the case of Margaret, bringing into being something that did not exist before through imagination and collaboration, and communicating it, rendering it public. So things and narratives, creativity and connections are precisely humanities material. The humanities bridge gaps between compartmentalized cognitive domains and foster relationships across specialties. They provide, I call it this way, the meta toolkit, which is precisely the narrative, to connect the toolkits of all the other different disciplines, to make them speak to one another, and also to work together towards a deep understanding of the human. So the humanities tell our individual and collective stories, our values, how we choose to live them, what drives us apart, and also what we share. So we really look forward to sharing many more stories and connections with you in the near future through the Humanities Initiative and all the other synergies that we're trying to promote on campus. So I can only say thank you so much to all of you. Thank you to our audience for attending, and please keep following us. Thank you.
To everyone.
Thank you.
Thanks, everybody.
It's great.